I'm in New York State, and we just got medical marijuana, and a number of states, approximately half of the United States, have medical marijuana. And as a researcher, there really isn't a lot of evidence medically in scientific journals on the efficacy of marijuana. And that is because of the legal status, not because people have it. The good news is that's slowly changing, and we're researching the benefits of this. But before we go off and prescribe it for everything, we need evidence based numbers. We need randomized controlled trials to prove this. So we're working on a trial that will work on nausea for chemotherapy patients. Now, I say nausea because I don't say nausea and vomiting. For years, we've lumped those two together, and they're actually two totally separate phenomena. The drugs we have now for cancer patients are incredible at stopping vomiting, but they do very little to affect nausea. And one can think of being nauseated yet being unable to vomit, which is a very unpleasant experience. So desperately, we need anti-nausea medications. And based on the evidence that's out there, we believe that marijuana is a very strong candidate. So we're going to test it to see if it reduces nausea. And marijuana also has effects on pain. So some of those chemotherapies tend to cause very bad nerve pain. So at the same trial, a very early pilot stage trial, we're going to also look at the effects on nerve pain and hopefully get placebo-controlled randomized data from this, gold standard type data that patients and doctors can use to say this either works, isn't effective, is effective, or is not.